The day is approaching quickly. Open enrollment for Medicare ends December 7th. If you keep putting the process off because it just seems too complicated, there are many counselors ready to help you answer your questions, including our next guest, Kimberly Latta with the Department of Regulatory Agencies, also known as DORA. Good to see you.
Thank you.
So Medicare open enrollment is going on right now, and this is really an important time.
It is. It's important because people with Medicare, this is their only opportunity in most cases to make changes to their Medicare plans for coverage in 2016.
Okay, so let's try and make this as simple as possible. There are 4 parts. There's A, B, C, and D. So let's start with A and B first.
Okay, so Part A is your hospital coverage, and Part B is your medical coverage. For most people, that means your doctors or perhaps your medical equipment.
Okay, and what about C and D?
So C and D is what's important now. For those who have C and D, this is the opportunity to make changes to those plans. So Part C is a managed care version of Medicare. So original Medicare is a fee-for-service system. That means every time you go, you get a bill, somebody pays the bill, one at a time. On Medicare Part C, all of that is bundled together and you get all of your coverage and it's all covered under one insurance company. And some people find that helpful and often less expensive. So they would choose a Medicare Part C plan.
Okay.
But if you have original Medicare, A and B, and you need prescription drug coverage, you would take Medicare Part D. So you have A, B, and D, or you have C, which replaces all of those others.
Understand. Okay, and again, if you want to go into a little bit deeper information, then you can call one of the counselors. They're ready to help you. The 800 number, it's 1-888-696-7213. Let me say that again. It's at the bottom of the screen, but write it down so you can call. It's 1-888-696-7213. If someone does have Medicare right now, how do they know what kind of coverage that they have? What's the easiest way to find out?
Well, they need to review what their current coverage is. And if they don't know exactly what that is, they can do a couple of things. If they're comfortable going out to the website, they can go to medicare.gov and look at the Medicare website, put in their information, and it will show them what their current coverage is. But for some people, that is hard, or they don't like computers, or they're not familiar, or don't have one. Then they can get help through the SHIP program. So we have counselors that will go to that website for them, put in their information, and print out their information and give it to them.
That's the SHIP program.
The SHIP.
Okay, interesting enough. What if they have Medicare and they're happy with what they have, the plan? Why should they shop around?
It's still a good idea to review your current coverage and see if it will meet your needs in 2016. Things change, medical conditions change, particularly prescription drug lists change. So I might add a new medication, but the current plan I have doesn't cover it. That could cost a lot of out-of-pocket for me.
I want to go back to what you said, the SHIP counselors, S-H-I-P as in Paul, SHIP counselors. Who are they? What do they do?
It stands for State Health Insurance Assistance Program. There's programs like this in every state. It's a federally funded program to offer counselors around the state. In-person assistance is really what it offers. So DORA contracts with 17 local agencies, probably one in your community, where you could go and get one-on-one assistance.
If they're a little confused, I would think that's the best way to do it then.
Absolutely. Some people even try to do it themselves and then call us and say, I think I understand, here's what I'm going to do and why, and we can say, you're right, you understood, and that seems like a good decision.
When it comes to Medicare, the word commonly used is confusion, and I understand that you're already here calling, people are calling saying, I'm a little confused about things overlapping. What's the issue there?
So there's another open enrollment going on, right, for the Colorado marketplace, which is where other people buy their medical coverage. That is not for Medicare beneficiaries. So Medicare beneficiaries have been calling to see if they can change their Medicare plan. So instead of calling Colorado a marketplace, you would call a SHIP counselor and we could help you with your Medicare plan.
Sounds so much easier. The number, call 888-696-7213. 888-696-7213 is the number to call, and they can help you through. Just ask for a SHIP counselor. Now, I'm sure a lot of viewers are getting mail about Medicare, and they're probably getting a lot of it. Is that a good thing or a bad thing?
So information is good. Too much of it is bad, because what we find is if you get too much information or you don't understand it, you're most likely to do nothing, which is not what we want you to do. So people might be going to information seminars happening in their community to hear about different plans. They might be getting mail, they might be getting phone calls. The easiest way is to, again, actually go to that website at Medicare.gov and do your comparison with the tool that was designed to show you your options, or call for a SHIP counselor and they can do that for you. We can compare all the plans that are available that do the best coverage for your particular needs, including pricing and quality.
And the last day of enrollment is December 7th. Do not wait until the last day to do it.
Absolutely. But having said that, you don't want to be pressured into a decision before you're ready. So also, with all the information coming, there are folks out there, fraudsters, let's say, trying to dupe you into making decisions or get your Medicare card and give it to them so they have the number and can fraudulently claim against your Medicare.
Oh, that's crazy.
Right. So you need to not be pressured. If someone's pressuring you and telling you you have to make the decision today, something's wrong. That should be a red flag for you. Don't do that. Take your time. You still have a few weeks to do this. Don't be pressured.
Got it.
And certainly report in any inappropriate activity.
Thank you. Very helpful. A lot of great information. Medicare open enrollment runs now through December 7th. You can visit Medicare.gov if you'd like to learn more. Better yet, call a SHIP counselor. Here's that number again, 1-888-696-7213, 1-888-696-7213.